So therefore he wasn't underperforming, but he was moved on. And we had another theory, which is, has Dr. Reti got to a position where he is so, the policies that this government's putting in, he maybe can't, did he ask to be pushed? And I wonder, did you have any insights or any thoughts as to why he left or was moved on?
No, I don't have any insights. It would just be conjecture at this point. I mean, I think there's a lot of anger in the community from patients and from doctors and nurses. And maybe that's reflected in bad polling numbers for national. Maybe they decided to just change things up. Maybe they need to make more harsh austerity cuts, and they just need to get a fresh face in there, like a fall guy, to do even more damage. I mean, maybe Shane did the first part of the damage, maybe the first third, and they need someone to progress the second stage. I mean, my prediction would be that in the third year, that's when you start seeing gifts being dangled, carrots being dangled, and that's when you might see them get a little bit nicer to places that they need the vote. Not Northland, because it traditionally votes national, but other places. And maybe you'll see a little bit less meanness and austerity, but I wouldn't guarantee that. So no, I don't really have any insights. For me, Pat, it doesn't matter which arsonist is burning down the house. Yeah. It doesn't matter what mask they have on or what sound bites they generate. Judge them not by their actions, not by their supposed reputation as a doctor, 20 years ago. Judge them by what they actually do. And I mean, if you use that metric of actual deeds, not words, you would see that Dr. Reti, and I'm charitable in calling him that, has done some truly horrendous things against the public health, whether it's supporting tobacco sales or tax cuts, $216 million to help Philip Morris out, getting rid of the smoke-free reforms, which actually National, the last time around, was the ones who proposed it. And Shane was a supporter of reducing nicotine in cigarettes, for example. And this time, I mean, I think his ambition went way beyond him being a doctor. And he was silent when the country needed him most. And was really not just silent. I mean, he voted for these things, whether it's assault rifles, whether it's raising speed limits, which will absolutely increase the number of fatal accidents in the country. Like, he, on time after time after time, he's been given the chance to be a public health advocate. The guy worked in informatics for a while. He did a lot of things, I think, to get out of being a GP. He was a dermatologist for a while. He was informatics for ages. But if anyone should understand how important it is to have good data and IT, it should be a doctor. But yet he was an integral part of slashing the data and IT jobs by 47%. That is destructive on a scale like we've never seen before, right? They've eliminated 9,000 public sector jobs. They really have gutted things. And like people in IT, for example, are saying, like, how could you have done this? We desperately needed a total refurbishment of our IT services. If you come in to me as a patient, I can't even access your medical data. Like, you might as well be from another country. No, our systems don't talk. So if you're outside my little region and you come to me in the middle of the night with a serious emergency, I don't have access to it. Even if you're just in town and you lived in my town, I couldn't access your GP notes. It's wild how badly we needed these things. And Shane knew it. And yet he voted or was integral in gutting service after service after service, including cutting, as I said, 47% of computer IT jobs in health. That's suicide. It's incredibly short-sighted, and it's going to be hellishly expensive having to hire contractors to provide all of these roles.